Well, folks, it is right at that 4:03 count. No pun intended with my 3, 2, 1 countdown, but I think we're ready to get the show started. So welcome. Thank you for taking the time to spend the next 45 minutes with Replicant and CorVel for a super exciting, at least we believe so, fireside chat on reducing average handle times by 50% using AI to automate patient intake. Joining me here today, by way of introductions, is one of our favorite customers, the Director of Workforce Automation at CorVel, Miss Cindy Gambosh, and I am Zach Cooper. I'm one of the Director of Sales here at Replicant. We have a very simple agenda for today, everybody. We are here for a fantastic conversation. Now, before we jump in, I do have just 1 or 2 slides that I want to go through, formally introducing Replicant, how we help our customers, and what type of challenges and what type of impacts we can make by automating the contact center. So we'll go over a quick little introduction of who Replicant is, and then we'll jump into Cindy and my conversation. Starting with who Replicant is, everybody, I think it's important to talk about the challenges that we help solve. And across 1,500, 2,000 conversations with your peers in the contact center, it really boils down to the same 3 categories of challenges every single time. Agents are overworked, attrition is skyrocketing, and hiring costs only continue to increase. Our customer experience, our customer satisfaction scores, we really have no efficient way or proven way of being able to show a positive increase in the experience because our self-service solutions today, they're creating speed bumps for our customers. And when I say speed bump, we all can speak to this from our own personal experience. Self-service just isn't able to resolve your issue or resolve your request, and you ultimately end up still having to speak to an agent. Now, we purpose-built Replicant to fully resolve calls, not deflect them, which we're all accustomed to as please visit our mobile app, please visit our website, or contain callers, which we all know as I'm sorry, I didn't get that. We purpose-built our technology to fully resolve customer calls, just like a live agent. And the opportunity is significant. A couple of years ago, we were talking 10, 20, 30% automation in the contact center in a very short amount of time. The opportunity specifically in healthcare is massive to fully transform the contact center from the traditional service model where leveraging AI, conversational AI, you can resolve calls end to end with minimal agent escalations, allowing agents to refocus on fewer calls and more business critical calls. And in doing so, the cost savings are significant, consistently upwards of 50% reduction in operating costs. And most importantly, everybody, going back to those 3 challenges, being able to improve on the customer experience, being able to increase customer satisfaction. Now, when I mentioned the opportunity in healthcare is significant, what I mean by that is through analysis and our customer benchmarks, working with companies like CorVel, we've identified a number of opportunities for automation within the industry, upwards of 75% of the contact center. Mm-hmm. And that ranges across a number of different use cases and call drivers, from account management to appointment management to frequently asked questions and different type of tasks around claims and refills. But what we're excited to hear from today is Cindy's journey automating her contact center. And we got some great questions prepared, and we're all looking forward to hearing from her and not me. So I'll step off of my soapbox, everybody, and we will jump in to today's conversation. All right, Cindy, you good to go?
I am good to go.
All righty. So Cindy, I thought no better place to start this conversation than to go back to the beginning.
Okay.
What was it like before you started working with Replicant? What were some of the challenges that really led you to start searching for an AI solution?
I really think you mentioned those, you hit the nail on the head. The challenges I was facing included an inefficient injured worker service. CorVel Corporation is a risk management company, and the department that I'm focused on right now is the intake department, where we have registered nurses that speak and assess an injured worker's injury to determine whether treatment is required. In our processes, the injured worker had to speak to multiple people. We had high support cost, and we were using our agents to spend time really on repetitive tasks. One of the other things that really has been hidden in discovery is the number of calls that our nurses were taking that were non-clinical.
Hmm.
Claim questions, where's my check? Who's my adjuster? At the end of the day, I needed a more manageable process that grew with us.
Inefficient process, rising costs, multiple touch
Yep.
points across that patient journey. As you mentioned, it goes right back to those same challenges we're hearing every single conversation. But I also imagine it looks like a tall mountain to climb. So as you
Very.
thought about as you thought about these challenges and how you were going to solve for them with AI, I mean, what did your process look like? How did you think about evaluating and selecting a vendor? Can you walk us through that a little bit and maybe touch on like what was important to you when looking for a partner?
I really did a deep dive
Yeah.
when I looked for partners. Our contact center is based on 5 9. If some of you may already know 5 9 or have heard them, they have an integrated solution. I already owned it. So and I already owned it. They one of the things that they use in their call routing, they use the natural language understanding and sentiment analysis capabilities,
Mhm.
but the program requirements didn't meet my needs. I then looked at Google and Amazon, quickly realized that the 5 9 solution was built on the Google platform that uses Dialogflow and Contact Center AI. I think they call it
Yeah.
CCAI.
CCAI, yep.
And what I learned with Google and Amazon was I needed developers. I
Mm.
needed developers to configure the turns and the conversation. If a person says, yeah, or, oh, okay, all of that had to be configured. So I was like, oh, I don't think I'm going to be able to do this. And I reached out to Replicant, where one of their advertising, their marketing pieces that really caught my eye was that it specialized in AI driven voice conversations.
Mm.
And that's really important. It's conversational AI. And the other thing that really caught my eye was specifically customer support. When I looked and I tested all these, I owned, like I said, I owned the integration already built into 5 9. I had a use case still running on that. Google, Amazon, and Replicant, and I stood occurrences of this, all four of them up and tested, and Replicant won. Replicant, and excuse me if Zach, if I'm stepping over, but Replicant of the four, I wouldn't say is the most inexpensive, but it's the best
Mm.
out of the 5 9, Google, Amazon, and Replicant. And those are big names. Replicant brought developers with them. So my experience in vendor selection, I to this day, Replicant is the right business partner for CorVel.
I mean, that's great to hear. And Cindy, I remember this. I remember when the team first started talk to you and how disciplined of a process you were following to make sure you did identify
Right,
the right partner because it's a transformative decision.
it
And
is.
it's great to hear that the value outweighs the price. That's what our mission is. And it's really interesting to hear I'll use the term categories of different technologies that you evaluated, because this is pretty common, and what we're seeing in the market is
Mhm.
with everybody going from on-prem to new CCaaS providers. Five9's a great example where they do have IVA technology. They do
Right,
have NLP, NLU, but they also, obviously have agent seats. So you really need to make the decision on where your best investment is, which the second option there is a build it yourself type of model. And
exactly.
what we see there is it really comes down to the level of effort that you spoke to, right? Those development resources, and do they have the expertise, and more importantly, do they have the experience? And that's what I've seen over the years in the industry is you don't want your team's first at bat to be one of the most important transformative decisions you're making. And that's the value Replicant brings to the table. And it's great to hear that, your team is having that experience.
We are. We absolutely are.
That's great to hear. I also know that when business leaders like yourself are making these transformative decisions, and especially when it is customer facing, it's patient facing, there's typically some hesitations and concerns across the enterprise. What were some of the internal challenges you dealt with, and how did you overcome them to get everybody into becoming believers that this is the only direction we can go?
Well, it started at the very top for me. I had naysayers at sea level that, oh, when I call my cable company or when I call, whoever, and there's this automated, resource, it just frustrates me. And
Mhm.
that was, everybody has that experience, right? Um, agent, press zero, do this, and you cannot get out of those systems. Replicant is, again, well versed in customer service and in our configuration and the way we have developed the conversation that we're having. And keep in mind, we're having a conversation with an injured worker. So
Mhm.
they're already they're escalated, they've hurt themselves. So it was very important for me to prove to our executive level that, we're making the right decision. We're taking a very small piece of the pie and we're going to automate it. The other challenges I had, obviously, because we are dealing with HIPAA information, is ensuring the security of the platform. And one of the other things that we're using is what Replicant calls a flex form, which is texting. So if any of you are texting, about the 10 DLC laws, the changes and everything that's going on in that area. And we came through the review and passed with flying colors.
Oh,
So I would say buy-in and security were the two biggest for me.
two most common I hear every
Yeah.
single, and you said a lot there that is worth unpacking. And I want to come back to a few things around starting small, the HIPAA, the security, the compliance. I want to come back to that. But
Okay.
something that you said that really caught my attention was conversational design. And I think that goes back to our earlier question around the different technologies you evaluated in the market. And something you said
Mhm.
about Replicant was, we focused on customer service, and that's what we built the technology for. We've trained our models specifically on customer service calls, but then it's not just having the technology, it's understanding the art of the conversational design. And it
Right.
sounds like for
Exactly.
your team, that was critical, especially knowing who the persona was on the other end of the line
Right.
as an injured worker. That's a lot to think about, going back to what you said, we started small. So digging into that a little bit more, talk us through what your rollout strategy was. Where did you decide to start? It sounds like, with some of the internal hesitations and concerns around the experience and security, it was critical that you got a quick win. So can you tell us a little bit about, after you selected Replicant, how did you know where to start? What did that process look like for you in rolling out the technology?
I decided to go to our most vocal customers and account managers and introduce the new process to those individuals. One of the things we were struggling with is our average speed of answer for our nurses. So we did have a group of individuals that we referenced as greeters that would answer the phone within our service level agreement and register these patients. This is the piece that we were automating. And in order to get buy-in, I made the decision to go to the toughest customers, the hardest account managers and toughest customers. There was 10 of them. And I did do some hand holding with those initial customers. But I quickly understood it really wasn't necessary. So we rolled out probably over the course of 10 months. But we started with some of the most difficult customers we have.
So average speed to answer was the immediate opportunity on the table. You looked at where can we start small to develop a quick win. Sounds like with the hardest customers, the account managers, there was
Right.
there was an opportunity to turn some of these folks into believers as well.
And then I used them as that. I used their sound bites and their experience, and one by one account managers, oh, just turn it on, turn it on. When am I going to get to turn it on? When are you going to do
Really,
this for me?
really.
So that was the outcome I was hoping for. I know I was rolling the dice, going with the toughest customers, but it was I did fully engage those customers and account managers.
You almost had like
Um,
a viral effect internally once everybody saw what you do.
yeah, it was people were lining up.
Like, the
When
lights
are
were.
we gonna when are we gonna get this?
Yep, yep. I mean, we see it's common every customer we work with. But what I think was so important about your rollout story, you mentioned the greeters. It sounds like there was a very transactional component to these conversations that was easy to automate. Which in doing so, I expect for the account managers and some of the other professionals in the organization, it gave them an opportunity to focus on other aspects of that patient experience.
I really want, and that's a good point. I really, when you're looking at, and I'll continue to use the term conversational AI, it will reduce the call time, it will reduce the cost, and it will size. It gives the opportunity for this department, the greeters department, no longer exists, but they are in roles in which we need the human touch in
Oh,
more important roles. So we would have had to continue to grow this team, even with the volume that we have today. At the point in time when we started looking at this, it was a team of 6 people. We do operate 24/7, but we could not have, it just didn't make financial sense for this team to operate 24/7. So it worked Monday through Saturday, 8 a.m. to 8 p.m. Local time. So 8 a.m. Eastern time to 11 p.m. Pacific time. They did not work on weekends, holidays, so those calls routed to the nurses. So if we would have kept that workflow, we probably would have needed about 15 to 20 greeters at this
Wow.
point. So when I talk about the cost savings of conversational AI, honest to God, it pays for itself over and over again. When we delve into the overall workflow process.
Yeah, I mean that's a big takeaway what you just said, right? It pays for itself time and time again. Something else you said there that caught my attention was you were able to take the greeters and essentially it sounds like put them in new positions, which
Yes,
I expect was very rewarding for them as well.
exactly. I mean, they were literally answering the phone. Thank you for calling customer name. Are you calling to speak to a registered nurse about your workplace injury? Blah, blah, blah. And, and then doing the registration. And then, they would do the routing to the nurse after this registration process.
So just by focusing on this small piece, you reduce the need to increase the size of the greeter team by 300%. Obviously, the
Yes,
cost savings, bring your own budget, if you will, right? With
exactly.
savings for new opportunity. But what I also heard is, and I expect you've been able to make this change. We weren't offering 24/7. Now we can
And we
with
do.
AI. So it's not just reduce the cost to serve. There's also, I'll use the phrase top line growth because you can handle more patient intake as well.
Yes, we can. And it's a very good point. It's 24/7 now. Replicant also sizes as we need, so if we get bombarded with calls, all of a sudden, an event occurs at an employer and we have a spike in calls, Replicant auto sizes itself. There's no concept of a busy signal or a wait time for the patient registration. And, I liken it to walking into an urgent care center. I mean, you don't talk to a doctor or you don't talk to a nurse. The first thing you do is register. So, that's essentially what we're doing with this conversational thinking machine for patient registration.
Mm, mm. Something that we hear time and time again from contact center leaders is being able to staff for capacity, and it's just this never-ending loop of capacity
Right.
issue. Sounds like you're a little familiar with that. But really, something that we don't talk about enough probably is the elasticity of the technology, right? And being able to scale up and down with your volumes 24/7.
Mm.
But from a scaling up perspective, obviously, right? You experience the benefits of that with not having to increase workforce by 300% to staff for capacity. But during those low volume periods, you're not having to staff down and you're not having agents sitting there waiting for a call, lunch, break. So, again, just part of the total value is being able to transform, which sounds like you're well on your way to get there. I said earlier I wanted to come back to a couple things from one of your earlier comments. We talked a little bit about starting small and what this rollout process was. You also talked about the importance of the information we were collecting during the registration process, PII and HIPAA related
Mhm.
content. How did you think about building trust? Sounds like very successfully with the internal workforce. What about that external user? What about the
So
end patient?
it's really interesting to me that the injured worker, they're they go through the process, pretty seamlessly. The other thing that we designed in this thinking machine is we don't make it painful to leave. If you want to talk to a nurse or you need to talk to a nurse, we're doing some listing. If we hear, shortness of breath, the patient registration ends right there and it goes right to a nurse. And that's one example. But if the person that's calling doesn't want to go to a nurse, they can easily escape. Where I had to focus on our buy-in, if you will, was with our actual nurses. One of the things that people that I was solving for was repeating information. So you call,
Mentioned that
you give,
earlier. Yeah.
yeah, you give your name and you give your name and you give your name. So one of the, adoption struggles that I had was having our nurses trust the technology, and understand the flex form. People with complex last names, as an example, they're they're spelled correctly now in our claim system. So, that's huge. I mean,
Yeah.
that's, and we have the person that is calling the injured worker confirming, yes, you spelled my name right. Yes, this is my correct date of birth. Yes, this is the last four of my employee ID. So getting buy-in internally. Externally was fine, because of the design of the thinking machine. It was internally that I had to work on getting our nurses to trust the technology.
Yeah, it's funny. We started the conversation talking about challenges, and
Right.
the challenges were severe,
Yeah,
and it was at the peril of the business that we couldn't overcome this. And then through a robust and disciplined evaluation, you find the right partner. But that really is just the second chapter. We've spent the
exactly.
majority of our conversation over the last 10 or so minutes really talking about building trust, both
Exactly.
internally and externally. And I know where the story is today, but for the audience, I think it's worth sharing a little bit, Cindy. Once you were able to get that adoption internally with the injured patient, how did you start measuring success? Because I expect those top line executives were starting to ask questions at some point. How is this going?
How's it going? And the dashboard, the replicant dashboard that comes along with the solution, they do have an executive dashboard, um, that more or less tells the story. I mean,
Yeah.
you can look at it. One of the things that is probably unique for our particular use case is the number of calls that were redirected. So one of the questions that we ask at the very first is, are you calling to speak to a nurse about a new injury? People that say no, and in the dashboard that, it comes up, it just comes up as the process didn't complete. That is a positive for us because we have redirected, and our account manager, I'm sorry, I should have that number in front of me. Our account manager put together a report that showed the number of hours that we saved our registered nurses, our valuable, most expensive resource that we have, by redirecting those callers that are asking, who is my adjuster? Who is this? To speak to a nurse, you do have to go through the registration process. And if someone says, no, this is not about a new injury, and no, this is not the first time I've talked to a nurse, that's a win for us. That is an absolute win. So when I was able to put dollars around the time that we're saving our nurses, because they can talk to more injured workers, they're not talking to somebody that wants to know who their adjuster is, as well as the overall time saved on the call, 2 minutes. We shaved off 2 minutes from the call. We retired an entire department that we would have had to have continued to grow. So that, I was and remain very excited when I'm in front of our executives and presenting the overall results of the implementation.
We started with the challenges, inefficient processes, overworked workforce, multiple touch points, repeating information, every single interaction. And what you just said, Cindy, is you've been able to essentially pull a 180 with
Yeah,
this.
absolutely. It's I am extraordinarily successful with how we approach this. Again, I approached it small, identified the use case, and in partnership with Replicant and their implementation strategies, and the understanding that we're always kind of fine tuning and tweaking the thinking machine, and we're starting to get into other areas as well. So we've we're successful. We are 100% successful.
Well, I think you've told this story immaculately, and I think we've been able to summarize it, pretty effectively. But
Right.
you just said it, right? Just getting started. What are you excited about next? Where are you guys going next?
Well, it's funny that this fell on this day. We just released the same thinking machine in Spanish, so we do have a lot of Spanish callers that were not benefiting from this. They were going directly to nurses, and we have Spanish speaking nurses and agents, but if they were busy, an interpreter had to come in. So we are on day 2 or 3 of our Spanish implementation of the patient registration process.
That's so exciting.
And yeah, it's super exciting. And essentially it's the same, it's the same thinking machine in English, but now we have Spanish. Next up, I am looking at a deeper integration into our system for our customers who have HR feeds. Another area that we're looking very closely at, we do follow-up calls for injured workers that we provide self-care instructions to. And we have people that make those phone calls. And as you can imagine, do you answer your phone if you don't recognize the telephone number? Chances are no. So we do that and we leave messages. The follow-up process, what we would like to do with that is be more proactive in regard to, okay, here is the flex form. We're following up on your injury from yesterday. Would you like to speak to a nurse? If they respond no, in the flex form, the automation and the integration in between the 2 applications would close that report in our system. If they respond yes, then we would, through technology, have 5.9 make that call to us, and it would route, because it's a follow-up. We know it's a follow-up call. we know we have the injured worker on the line, we would route that directly to the nurse.
Hmm.
There would be, are you calling for follow-up? Are you doing this? Are you doing that? If we're able to automate that process, we know we've got the injured worker on the line. They're there and they want to speak with the nurse. So let it through. Let that call through and let it route directly to a nurse.
And that's how you go from one use case to automating
Yep.
75% of your contact center. There's the playbook. So
Yep.
thank you for that, Cindy, which I think goes into our last question. And you and I were talking beforehand. I think it's the most important question to ask. What advice do you have for the audience who's just getting started with this new realm of technology?
Do your homework. I did a lot with looking at the big guys. If it is a contact center and it's customer service, you can't go wrong with these guys. Replicant, has proven their worth. The other thing is to understand your use case. Don't and keep it manageable. We will continue to grow. Scheduling. There's countless use cases for this. One of the other things that I really focus on is not to over-architect the solution. Let Replicant do what they're good at, right? Let them bring their expertise to you in terms of filling out their implementation documentation, listening to the turns. You want this or you want that, and build your implementation on the customer experience. The cost savings will be there, and the executives and the C-suites and all of those will want to see that will be there. But for people that are looking to implement this, implement it based on improving the customer service. And like mine, your implementation will be a slam dunk.
Slam dunk. That's what we love to hear. Cindy, we only got 5 minutes left. We do have a handful of questions. We probably have time for two from the audience. Somebody asked, how do you balance, and you touched a little bit on this, how do you balance the need for automation and efficiencies with maintaining a personalized and empathetic patient experience?
That is an absolutely fantastic question. And that was a question that was brought to me. I am doing patient registration only. I know the person that is on the other end knows throughout the whole interview process that they will be transferred to a nurse. We do make that statement. You will be transferred to a nurse after we complete this patient
Tell them what it's
registration.
in it. Tell them what it's in it for them. Yeah.
And it's, we don't say it just once, through the interview process, to keep them engaged. They know they're going to speak to a nurse. So we're not looking at, replacing that medical staff. We don't ask medical questions. We completely stay away from that. So maintaining that customer service level that they are going to speak to a nurse is through reminding them as they're registering, thank you. I think we say it twice, that we will transfer you to a nurse. So we've maintained that personal customer service just simply by taking the front end registration piece of it off. When they get to their nurse, boom, is immediately assessing the injury.
So that's actually the very next question, probably the last one we have time for. How are you getting this information to the nurses after they talk with the thinking machine?
So one of the things, and I don't know that I've really touched on the ease of implementation. We use 5.9, and 5.9, the communications, the dial tone, if you will, goes through 5.9, but 5.9 hands it over to replicant. Replicant does its thing. We do have a handoff from replicant to
Okay.
our customer service, our CRM, if you will, and then replicant hands it back to 5.9. 5.9 hands it back to the nurse, and the nurse is able to see the data that was captured through the registration process in our system. So it's through APIs.
Through APIs, but full context is being passed, which is why the caller
Yes,
doesn't have to repeat themselves, why the nurse has a
exactly.
proficient experience. Win-win for everybody. And I think that's a perfect way to end the conversation, Cindy. Win-win
Thank
for.
you, everybody.
Oh, thank you. Thank you, Cindy, first and
All
foremost.
right.
Great talking to you. Thank you to all our attendees. This will be available online. It has been recorded. If you have any questions, please feel reach out to the Replicant team. Feel free to reach out to me personally, zcooper@replicant.ai. We're here to help. And thanks again to our VIP guests. Thanks, Cindy.
Thank you.
All right. Bye, everybody.
Bye.